Thanks, Zach.
Thank you.
Thank you.
Good job, everybody.
Nice. So welcome to the project team for Training the Future. A little bit of a background on this is that in Ecuador, medical students are not required to receive a bachelor's degree before entering medical school. And they only receive about an average of 5 years of education. Residency programs in Ecuador do not exist. So what this project team has actually put together is a project to see if we could actually develop a residency program at FIBUSPAM. A little bit of background on this is that we had some good feedback from a variety of people, including Dr. Carlos Gonzalez, once again, really providing some wonderful feedback to us as we developed this. But a lot of this work was a result of independent research by this team that they put together. They studied a variety of different residency programs. They studied residency programs not only in the United States and Europe, but also in certain countries in South America. I'll elaborate on anything at the end that we don't cover in this presentation. But yeah, please feel free to start introducing yourselves. At the top of my list is Sina.
Hello, I'm Cecina. On this team, I was a project manager. I am going to be a rising junior at Princeton University, and I major in ecology and evolutionary biology. And also, I'm on a pre-med track, so I was really interested in this project.
Cecina, can you, yeah.
Pardon?
Can you pick the next person? Yeah.
Yeah, I'll introduce Meredith.
Hi, I'm Meredith. I was research manager on this project. I'm a rising senior at Princeton, and I'm majoring in history, and I will be pursuing my MD post-graduation. And the next person is April.
Hi, I'm April. I'm a rising sophomore at Princeton. I'm not too sure about my major right now, but I am pre-med. Next on my screen is Adrian.
Hi, my name is Adrian. I am a rising junior at Princeton University studying molecular biology and global health. And I'm also pre-med, a lot of pre-meds in this project. So next for me is Cody.
I am Cody. I am a rising junior at Princeton University. I am also mobile, global health, and also pre-med. Yeah, and so last is Charlotte.
Hi, I'm Charlotte. I'm going to be a rising sophomore at Princeton on the pre-med. And I'm studying biology and musical theater.
Great. Well, I believe you guys can screen share. You guys can get going.
Hey, Zach, while they're doing that, can I ask, what is a rising junior or a rising sophomore? That's a new term for me.
Oh, it just means that this coming year I will be a sophomore, or I will be a junior.
This coming semester, okay.
Yeah, it's like a term you use in between years, like during the summer usually.
Okay, that's helpful, thanks.
All right, this is our project, Training the Future, recommendations for a residency program. So a quick overview of a typical medical education. This is kind of a layout of what it's usually like. It sometimes is different depending on the healthcare system, the country, the program itself. Within certain countries, there's different kinds of programs, but here's a typical pathway to medicine. You start out with like pre-undergraduate coursework. That's like high school, secondary school. Sometimes if in certain countries, it might just be a series of certain classes or exam scores you have to participate in and complete. Then you have your undergraduate training, which is more classroom focused. That will be mainly your science classes, sometimes math classes, and like social studies and that kind of field of just in general, like classroom focused training, nothing clinical yet. And then you'll have your formal medical schooling afterward, which is, I guess, what we would refer to as medical school. And that would be more clinical exposure. and you're introduced more to patient-doctor interactions and that sort. In some countries, in some instances as well, there may be the same degree might cover undergraduate training and formal medical schooling. So you'll hear sometimes the term undergraduate might just be someone who has completed both undergraduate and formal medical schooling, but has not yet received postgraduate training and practice. And then finally, we enter postgraduate training, which is kind of what we're going to focus on. So postgraduate clinical training will give you more exposure to specialization, and that's the necessary. That's when you get more focused exposure to whatever field you want to practice in. And there's also beyond residencies, other types of postgraduate training, but this is kind of an overview of what medical education entails.
So first up is the needs analysis, which is why is a residency program even needed? So clinical experiences, particularly the specialized experiences that residency programs provide, are really invaluable educational opportunities for medical professionals in training because of the necessary practical exposure that they provide for the student. Secondly, competent and confident medical professionals are needed in Ecuador's growing community-based healthcare system, especially since as of 2016, there were only 2 physicians for every 1,000 people in Ecuador. Additionally, the Ministry of Health's primary care initiative necessitates a full scope of medical services, which again emphasizes the need for these specialized programs. And of 19 undergrad med schools in Ecuador, just 12 offer post-grad clinical education, and none of them are located in the Oriente or Insular regions. And why FIBUSPAM as a place to start a residency program? Well, first, FIBUSPAM already has the infrastructure as a hospital and has already established an atmosphere as an organization that is dedicated to Riobamba and the surrounding Chimborazo province. They already have an array of specializations that are tailored to the needs of this community, as well as, of course, their staff of highly dedicated physicians and medical professionals that would be of great help in the residency program. Secondly, it would be a unique opportunity to gain extensive clinical experience that we said is already needed in Ecuador. First, of course, in the hospital under attending physicians. And when we talked to Dr. Carlos, he said that the existing physicians there would be happy to mentor residents. And additionally, because FIBUSPAM receives about 20 medical missions per year, they could also receive insight and guidance from visiting physicians and their specialties. And these residents will be able to work and help contribute to developing efficient healthcare service delivery. And finally, permanent placement. So one of the big things that came up when we were looking at residency programs is that a lot of the med students travel abroad to continue their training or to get specialized training. And once they travel internationally to complete their training, they often just stay there, which is a big cause for the shortage of specialized doctors in Ecuador. So by creating this residency program, it could provide incentive to keep those doctors in Ecuador. Other benefits include continuing developing relationships between residents and patients, creating a appreciation of community-driven healthcare, and creating opportunities for residents to get skills and experience necessary to treat the prevalent issues in Ecuadorian populations. And now we're going to do an overview of the medical education that currently exists in Ecuador and other areas around the world. So for undergrad med school, 6 to 7 years, admission is based on an entrance exam and or pre-university coursework, which is usually 3 to 6 months. And programs are only located currently in the coastal and Andean regions. During the first 3 years, like Cecina was talking about in the outline, it's more coursework, classroom focused. So students are taking the gen ed science courses in a lecture setting. And then years 4 through 6 is when they focus more on professional education with more specialization and they can begin doing clinical rotations under the supervision of attending physicians. And then year 7 features a rotation of internships, which are approximately 2.5 months each. And students are also required to do 2+ months of extramural or pre-rural rotations, which is a salaried position funded by the government. And then unique in Ecuador is this 1-year rural social service, where it's obligatory to do this in order to receive a medical license or practice medicine. And this again is a salary position funded by the government. And then as far as specialization in Ecuador goes, here are the current options to pursue specialization. And once you get to specialization, there's a steep decline in program availability and accessibility. So there is clinical specialization, about 3 years, like I said, highly competitive, and requirements are usually a graduate degree, high exam scores, and you have to have 2 academic journal publications. In addition, you have to be less than 35 years of age and have an academic record with no scores less than 80%. Another option is a higher diploma, which is the most common post-grad pathway in Ecuador. It's usually completed prior to pursuing a clinical specialization program if you are interested in that, and no clinical work is done to obtain a higher diploma. And then there's course specialization, which is academic training. It doesn't include any clinical specialization, and students have to complete a thesis to graduate. There are options to get a master's degree, but students must complete a thesis to graduate, and then PhD degree. And we thought we'd note that there are no current programs available in public health or health policy. And in order to obtain this degree, you first have to have the clinical specialization, course specialization, or a master's degree to enroll. And you have to have 1 to 3 papers in academic journals.
So next, we're going to be kind of drawing comparisons between medical education in Ecuador and in other countries. So first is in the United States, where usually consists of 4 years of undergraduate study, where students will do prerequisite classes in order to enroll in medical school. The next 3 to 4 years, one can pursue a medical degree such as an MD, which is just a medical doctorate, or a doctorate of osteopathic medicine, which is a DO. It's also important to note that there's some variation in this path, as well as some undergraduate programs offer kind of accelerated versions, so a faster way to get your bachelor's degree and your MD, and that there are also joint degree programs available, such as getting an MD PhD, MD MBA, MD MPH, which typically takes a little bit longer than 4 years to complete, but a shorter time span than pursuing each of those degrees individually. During the 3rd or early 4th year of medical school is when students will apply for residency programs. And so upon receiving their doctorates, residency will be 3 to 7 years based on specialty, with an additional 1 to 3 years in fellowships for subspecialties. And then after residency is done is when doctors are fully licensed to practice. So applications for residency programs typically consist of a personal statement, an interview, letters of rec, med school transcripts, medical student performance evaluation, and then USMLE scores. And applicants are admitted through the National Resident Matching Program. So basically that means that applicants and residency programs rank one another and are matched by computer algorithm. A resident will work a maximum of 80-hour weeks and will oversee around 10 patients as the main physician. During residency, they will perform clinical duties and build patient rapport. So the sample program that we looked at is the Providence St. Joseph Hospital in Eureka, California. Their 3-year program focuses on family medicine and trains residents in the unique challenges of rural medicine. Residents earn about $60,000 a year, with salary increasing by a couple $1,000s each year. And most time is spent in inpatient care, so around 8 to 16 weeks per year, but residents will have rotations in many other areas such as intensive care, gynecology, dermatology, and pediatrics.
So another country that we looked at was Colombia in particular because of its proximity and similarity to Ecuador in terms of population and proximity. This is kind of a pretty similar pathway as we talked about with Ecuador in terms of undergraduate coursework spanning about 6 to 7 years, and that will be both the classroom and clinical training. Students will start out in the first 3 or so years working in learning in classroom settings, mostly gen ed courses and certain pre-medical courses. And the later years will be transitioning toward clinical exposure, and they'll be working with patients. And in recent years, there's been more of a move toward early contact with medical students with patients, so moving ahead toward the clinical training as soon as possible. And the sixth year, like the last year, will be called the internship. It'll be essentially dedicated to clinical rotations in about 4 or so specialties. In the last year, students will take a general exam, and they'll use that exam to and usually that exam is less so of a qualifying exam for anything further, and more of an audit of students' capabilities and their proficiency for essentially for the government to see the status of medical education and how far students have come along. Then afterward is a government-mandated service program. Usually students will be posted in a rural or otherwise underserved community, and it's very similar to Ecuador's rural social service program. And this is also mandatory before students can, or doctors can practice. And it is after this point that doctors are essentially fully licensed to practice, but have opportunities for postgraduate training. In Ecuador, at Colombia, this postgraduate clinical program essentially is about 3 to 4 years and is what we could call a residency. There is about 60, if you want to go, hold on, I'll get to that later, but in this, there's about 61 programs in all of Colombia, and they're offered usually in Bogota or in surrounding areas of Bogota and typically in urban centers. And they'll usually, this will be a more of a specialization period. And then afterward, there's an optional master's or degree PhD programs. It's not necessarily as linear as it's portrayed here, but this is what would be considered a typical medical pathway. After PhD or master's, usually students will be, doctors will become professors at medical schools or at universities. And the last stage will take about like 2 to 4 years, depending on which degree and what kind of research you're pursuing. And so as we talked about before, residency in Colombia is usually offered to prospective physicians after they complete their 6-year undergraduate medical school training. So that after they complete their undergraduate, as we mentioned before, it may be kind of misleading to call it undergraduate, but that's kind of what we would consider after finishing medical school. So there's a series of examinations, reviews that will allow you to be admitted to the postgraduate clinical training. In this case, those are called the medical schools. So beforehand, as we talked about, they have to complete that mandatory service in hospital for a year before, and that will be kind of the setup before you can apply to a residency in Colombia. So most of the programs offered by private institutions. So as Colombia is quite similar to Ecuador in that there are free public universities, but you'll find most of these programs are offered in larger capacities in private universities. There's a limit of 66-hour work weeks for resident physicians. This has been, I think it's pretty recent institution of this work hour cap, as maybe you might know, you might not know, residents are known for their excruciating schedules and their like very long hours and sometimes are spent up to 24 hours at a hospital. They also have certain rotations of in-classroom lectures, clinical work, and independent research. So the curriculum will typically establish like specific periods of time that they do so. So they'll observe medical procedures, they'll perform under the guidance of a medical teacher or attending physician. and they'll perform independently under supervision of a specialist, and they'll also attend university to study topics related to specialties over the course of their residency. And most programs will actually require the completion of a research project for graduation. So it's very much incorporates the idea of it's, I guess, very similar to like an MD/PhD kind of program. And other graduation requirements will include also a written test, oral exams, and assessment of clinical competences and attitudes towards patients. And a sample program that I kind of looked into was at the Universidad de La Sabana. It's also a private university in Chía, near Bogota. So they have a whole array of specializations, but particularly in pediatrics and ophthalmology, those are usually 3 years long, and they'll rotate among 4 to 5 sites in Bogota, among like certain clinics, hospitals, and also on site at the university. They'll all have certain courses in independent research, research seminars, and professional development each year, in complementary to their clinical exposure and clinical work. So this is quite typical of a residency, and it will vary by specialization, might be longer or shorter, but that's typically what it's like to be a resident in Colombia.
Okay, so similar to why we decided to look at Colombia, we also decided to look at medical education residency in Peru due to its proximity and similarity to Ecuador. And so the way that it works in in Peru is that you would also attend medical school for 7 years, in which the first year you would be learning some basic pre-medical and general courses. And then the second and third years, we would be learning some basic science courses, and then applied science courses. And then the 4th, 5th, 6th, and even 7th years, you would be taking some courses on clinical science or surgical science. And in order to graduate from a Peruvian medical school, you would have to take an exam, which is the usual route, but there's also a secondary exam that would be to defend a thesis. This route is optional, and so I'm assuming that not many people would actually take it. And after you graduate medical school in Peru, you are actually now fully able to practice as a general practitioner, because after you finish medical school, you would get 2 titles. You would get the title of surgical doctor, or which is basically a general practitioner, and both a title of well, translated, it would sort of be an undergraduate degree in medicine. And so after that, there is now the option of participating in 1 year of a social medical service, abbreviated called El Serums. This 1 year of social medical service used to be required for graduating medical school, but they changed that in the 80s. And so this is now no longer required to graduate medical school, but it is required to apply for a residency program. And so there has been this El Serums program has gone through many changes, and it has been shown to be improved over time, some of which are, back earlier when it first started, you would be placed in a location based on basically luck and just wherever you happen to be placed. But now they've changed it to be more merit-based. So there hasn't been much information on it, but I'm assuming that, if you've shown better scores or on your graduation exam, then you'd be placed at a more high-level clinic location to perform this medical service. And so after completing this 1 year social medical service, then you are now also able to apply for a specialization or a residency program. These programs can go from 3 to 6 years, but after 3 years minimum, then you are able to obtain the title of a specialist. And yeah, thanks. And if there are 3 ways to apply to this residency, this article that I found it on was in Spanish, and so the translation is a little bit confusing to me, because Okay, I'll explain first. So the first entry way of applying to residency they described is ingreso libre, which means free entry. And so this way of entry is for people who are not employed by the Peruvian state. And so this person would have to search for public and private funds to finance some of the costs of their residency education. The second way is described as por destaque, which this pathway is for those who are employed with the state and they are actually financed through the place in which they work. And the third way described as modalidad cautiva, which sort of translates to the preferred method, but is for those who belong to the university that is offering the residency position. And this pathway was created for general medical practitioners, especially those working in the public sector. And so residency programs in Peru are carried out in both public and private hospitals through partnerships with local hospitals for training. And even though it is carried out in both public and private hospitals, residency programs are actually mostly funded by the Peruvian state. And so, for example, as of 2014, there are 19 internal medicine residency programs in 11 regions of Peru. 2 regions have medical schools, but they have no internal medicine residency program. Now, these 19 medical residency programs, I do want to emphasize that it is only internal medicine. I was unable to really compile data onto other types of specializations. However, one university is described to have about 36 different residency programs and 16 subspecialty programs as well. And so, it does show that residency programs and different kinds of residency programs do exist in Peru and exist throughout the country. And if you are in a residency program, it technically is automatic graduation. So unlike applying into medical school, graduating from medical school, and also even applying to residency where you have to take an exam, there is no national exam for graduation from residency. And this is explained as due to their lack of specialists in country. And so they basically want to give as many people the option of becoming specialists so that they remain in the country. And the numbers keep growing in the country. And the last piece of information that I want to show is that all doctors are actually required to be recertified after 5 years. This includes specialists and general practitioners. Obviously, the practical limitations do apply. So and it was not explained what percentage of doctors actually are certified. And this is just a diagram showcasing an example of the residency program's curriculum of internal medicine in Peru. So these are 4 different universities, and as you can see, there are differences among them, but in general, there are years dedicated to research, to clinical experience, and also to theory too, and management, which is gerencia. There's also, on the second and third columns, there's also years dedicated to bioethics as well. And so we could actually see that these residency programs actually do cover a lot of ground and are therefore are able to churn out very successful medical doctors in Peru.
Okay, so now we're gonna head back to implementing a residency program in Ecuador through FIBUSPAM. So this was directly taken from our feasibility analysis, specifically the marketplace analysis section. So information for the section was really gathered from the research done on the current state of medical education in Ecuador. Our target population is currently Ecuadorians pursuing degrees in medicine. One of the main problems the Ecuadorian system faces is new medical students completing most of their training abroad, and often in many cases they don't come home and they stay there. So through this program, we hope to provide some sort of incentive for aspiring doctors to remain in Ecuador. By doing so, the program needs to provide like high quality teaching and clinical exposure, as we talked about with other comparable programs abroad. And this program would also greatly benefit the local community in the Chimborazo province due to the increase in medical personnel in the area for a long period of time. So hopefully this leads to more continuous and sustainable care for the population. At its start, we think that the residency program should only focus on aspiring doctors in Ecuador, and the target market is clear at this time. So this is the business strategy section from the feasibility study. So as an organization, we eventually aim to accomplish the implementation of a residency program, which does provide extensive clinical training to those medical students who pursue it, preparing them for the profession and also benefiting the community at the same time. And this will also allow the new doctors to remain in country. Again, like we said before, our target market is Ecuadorians pursuing a medical degree, and we hope to reach them by getting the word out through information sessions, pamphlets, and other promotional media. Ideally, these materials would be distributed to undergraduate medical students throughout Ecuador, as well as through the FIBUSPAM and PACH network. At this time, the creation of these materials are beyond the scope of this project, which is right now, but it should be passed on to the next team working towards this cause.
And moving on to organization, staffing, and technology. Organization and staffing is a consideration for the successful implementation of the FIBUSPAM residency program. So to start out, we're going to start small, and we aim for up to 3 residents at one time. As stated previously, a major issue in the Ecuadorian system is a lack of physicians in Ecuador who would be able to teach in medical school and/or a residency program. However, FIBUSPAM is appropriately staffed and has enough physicians full-time to support this program who are also enthusiastic about mentoring future residents. Additionally, due to the approximately 20 international medical missions each year, further teaching opportunities are available to residents from visiting physicians. The residency program does not require major new technology for implementation beyond existing doctor supplies. Basic supplies for each resident include a lab coat, sterile gloves, and other disposable dressing scrubs and a stethoscope. We would look to cover the costs of these supplies largely via donations. In terms of the general schedule, the first thing that you'd want to do is establish a financial plan, create budget and funding timeline, then develop a specific educational vision and goals based on, what you want this resident program to bring to the students and the community. Then you would seek approval from the Ministry of Health and/or the Ministry of Education. And you'd of course recruit and train physician teachers and staff. And then you would move on to curriculum and program design. And it would be a great idea to build off of some of the other Latin American and potentially US programs, specifically the Peruvian residency program that Cody was able to find. The 6th step would be marketing development and reaching these medical students, and then active recruitment of these medical students. And then finally, it would be orientation for the incoming class. And, in terms of it being scalable, the residency program fits into FIBUSPAM's current model and can be replicated for growth. They are capable of running this program with additional supplies. It's complementary due to the inherent hospital setting, and it is scalable to a pilot cohort of 3 residents with the possibility of eventually expanding capacity and extending to other hospitals across Ecuador. In summation, the current Ecuadorian medical system is based upon undergraduate medical school, supplemented with various postgraduate routes and a rural social service year. However, it does not feature any residency programs in which aspiring physicians can receive comprehensive and extensive clinical training. A residency program in the country would encourage physicians to remain in Ecuador as well as benefit the communities they work in, enabling increased and more continuous care for Chimborazo province. FIBUSPAM is uniquely qualified to implement and develop such a program between the hospital infrastructure, physicians on staff, close involvement in the local community, and the international support from PACH. In terms of sort of general recommendations based on this research, we would recommend that FIBUSPAM would utilize holistic admissions process. So reviewing the academic record and exam scores, as well as an interview process and a personal statement. FIBUSPAM should also collaborate with full-time physicians at the hospital and partner doctors internationally. And potential program focuses could be family health, internal medicine, pediatrics, and ophthalmology. Thank you for listening.
Thanks. Thank you, guys. This was really neat. This is you guys really laid like a foundation and perhaps, I mean, actually really a justification for us to look into this seriously. I really enjoyed all of the in-depth information that you guys put together. And this would be a very, very ambitious and intense goal to accomplish something like this. And this definitely laid the framework for our teams to take this seriously in the future, should we find a right time to do that. But yeah, this was really, really interesting. And I will tell you from that 1 year residency, or the 1 year rural residency program in Ecuador, I can tell you from experience with several of my Ecuadorian friends that it is it's kind of a free for all and not very well managed that well. And so the chance to have someone in Ecuador actually create a residency program is inspiring, and I feel like there is very much a need in the country for that. Yeah.
Can I ask a question, Zach?
Go for it. Yeah.
What underlies the confidence that the group seems to have that FIBUSPAM has the qualifications to run such a program, and who would authorize us to do that? What would qualify us? I mean, I'm just curious to know who makes that call? Who says, yeah, FIBUSPAM, go ahead and establish a residency program? Who would say that?
So as we talked about earlier, there is not really a framework for a residency program in Ecuador as it stands. So FIBUSPAM would be kind of pioneering in this. So it would probably have to first start out with FIBUSPAM making the decision to establish something and propose it to the Ministry of Health, which would be the one to approve something like this.
Okay, so there is no existing framework.
No, I'm not sure what the certifications would be. I'm sure that's more nitty-gritty in the technicality of like law and that sort of thing, which I don't know if we're really qualified to give advice on. But that would also be another direction for future work, would be kind of looking into what the qualifications would be or what to propose as qualifications, because I don't think any such exist as it stands.
Okay, I also want to make you aware of something that I think that I don't think I understand at all completely, but it's a major factor, and that is the role of Cuba. Many of the physicians that I have come into contact with in Latin America have trained in Cuba, and it's almost like that's their residency. And they go to Cuba and they qualify through the government of Ecuador, and for free they get the privilege of living in Cuba, doing what I think sounds a lot like a residency that takes several years. And in addition to getting trained as a surgeon, they are also in charge of a sector. They become the doctor for a sector in Havana or a sector in the country. And then for that privilege and they earn nothing. I mean, basically nothing. I think it's $25 a month. And then after that, they come back to their countries almost like a military program where you owe the country X number of years of service for this free training that you got in Cuba. And anyway, I've just told you more than I know, but I think this is a major factor in countries like Ecuador, Colombia. You'd be surprised how many of these people have trained in Cuba.
I think that kind of reminds me a little bit. I know my father was a doctor in Eritrea. It's not a very conducive, or doesn't have as many resources as a lot of countries abroad do. So they have something similar where they would send doctors abroad to train and then come back for a certain amount of time to stay.
Right.
I think, though, the main issue with something like that would be there's not much incentive to stay after the established period of time you have to serve. And also there would be a lot of instances where doctors just wouldn't come back, whether it was because they got a visa somewhere else, so they could just overstay their student visa. I don't know exactly what the situation is with Ecuador, but I hope that with something comprehensive in Ecuador that we could have incentive for doctors to stay, and not in the, I don't know if this is the right word, but like in a begrudging way, not in a way that's like mandated, but in a way that's like incentivized.
Yeah.
That's our hope. I'm not sure what the exact steps would be to incentivize such a retention rate, but yeah.
The other thing that I wanted to bring up, well, a couple of things. The idea that these people are very mobile. There's no question about that. These physicians are very mobile. They go from country to country. Why do they do that? They do that because, for example, half of our physicians now at the clinic are from Nicaragua. Why? And because they had to get out. You know, these people are at tremendous risk in Nicaragua, including Dr. Oscar, who I probably told you about before, who's been tortured. And this is a reality that I can't even get my head around. People from Venezuela that have been imprisoned that have to get the heck out of there. So there's a lot of mobility among Latin American countries with physicians. And there's another reason why that is, that this doesn't really have anything to do with residency, but I think it's important for you to know that malpractice insurance does not exist in Ecuador. The whole concept of it is lost. Nobody has malpractice insurance, and I have no malpractice insurance at the clinic. So you ask yourself, well, wait a minute, what is there to protect the public? And the answer is there really isn't anything, except that if you harm a patient, if you have what we call a bad outcome, right, and somebody passes away, you go to prison. And we have had physicians at the clinic who have disappeared because they've had a bad outcome, not at the clinic, but in other places where they work. And they just are gone because they don't want to go to prison. And so there's a lot of uncertainty and instability for these physicians down there. And so, you know, you wonder, well, why don't they come back? Or why do they go here? Why do they go there? They go there, they move around for a whole bunch of different reasons, including, I mean, that's an awful punishment, you know, to go to prison because of an error, or, you know, just human errors, things that happen, you know, I mean, that's, so anyway, I thought I would bring that up because that's sort of, I think, relates a little bit to what you're talking about, but I love the idea. I've never even thought about this before, but yeah, we have so many doctors there now. You know, let me ask you a question. Would a doctor, would an attending, or whatever you would call the teacher, the sponsoring physician, would they get paid? Would we be proposing to the government that they would be paid for that? Or is this just sort of a volunteer thing? What are you envisioning there?
I think typically with attending physicians, I think it's a separate salary position by whatever institute, because it's a teaching position along with just providing care. So I'm not sure what that would look like for FIBUSPAM or what the capacity for that would be, but I know it's usually treated as a separate position other than just being a doctor.
I mean, the government's broke, so there's probably no money to do it anyway. And then you say to yourself, well, if I'm Carlos Gonzalez, do I want the risk of having a resident? I don't know. This is a super interesting subject, Zach.
Yeah, I think it's probably where the scalability comes into play. Even if it's just one resident that we can manage at one time, and finding out what the best way to source funding would be, or to allocate funding in this case.
Mhm.
So it doesn't have to even be a large program to begin with. It's like a pilot, would be a pilot class. So yeah.
Maybe there might be a university hospital or some hospital in the United States that might be willing to sponsor a resident or something like that.
Oh, I know Dr. Gonzalez had talked about looking into bringing students from abroad and making it an internationally available kind of program. So I don't know what stage that would be, but yeah, I think said he was interested in that.
Yeah, he emphasized just like some form of intercambio, some exchange thing from like, he thinks that would be, just kind of fitting within our model anyway, just with how we host so many medical missions. Why can't we host some type of residency team or resident education team from the States, from the States for a little bit? But yeah, I think, this project was inspired by Sarah and Tyler and the Trek team's conversations in the past about just that, the fact that Ecuador doesn't have a residency program. And yes,
Doesn't have a residency program.
a lot of potential for collaboration. Yeah.
Huh.
Paul, can I just interject a little bit from personal knowledge? Most residency programs in this country actually have partnerships with programs in mostly third world countries, now somewhat in the Middle East as well. And the residents would go out for only several months at a time. They would not go out for a full residency. The other thing I can tell you, having dealt with medical malpractice insurance in this country, is the residents that do go abroad, while they're there, if they're in a certified residency program in this country, are covered. But I don't see any coverage for malpractice for residents that would be full-time there. So it might just be a rotation through for several months, as we've kind of done with several people in the clinic. Just wanted to add that point.
But the primary focus here really is on Ecuadorian doctors, right?
Yeah.
How do we get them more training, right? Not so much. So I was thinking, yeah, okay.
Definitely. And also I thought this potentially could have been very interesting for our interns, but as they were doing this research, as you guys possibly might be formulating your trajectory of your studies and careers in the future. And yeah, I figured I learned a lot from it, and I hope you guys did too.
Yeah. Super interesting.
Thank you. Yeah, I personally learned a lot through this process, so it was interesting.
Mm-hmm. Wow.
Hi, Mary. It's Owen.
Okay, so yeah, I would expect. Thank you guys very much. This is something that's definitely going to be considered. There's a lot to think about here, and it's a great undertaking, and could potentially lead to something really interesting, a new manner of serving the communities of Ecuador. And thank you guys so very much, and we'll see the Farming for Solutions team tomorrow.
Thank you very much.
Thank you.
Thank you.
Good job, everybody. Thank you.